So what I wanted to talk about this morning was just a kind of taking a step back to assuming that global health security is something we should be pursuing, and actually thinking about kind of the more structural issues behind it and the assumptions behind it. So I talked about how global health security can distort agendas. So for example, in Ebola we saw that kind of a security agenda prioritises policy responses which focus on that one disease. So we saw an increase in maternal mortality, an increase in newborn deaths, in obstetric complications, and a massive decline in routine vaccinations for children. So just to think about the kind of ethical questions there behind, well, why are we prioritising some people's lives over other people's lives? The other thing I talked about was about sustainability of global health security initiatives and policies. So, for example, in Zika, we look at the fumigation efforts, which have been absolutely outstanding, and the rates of Zika have absolutely plummeted, which is fantastic, but they're not sustainable long-term issues, and we haven't addressed the sort of housing and access to water and access to contraceptions, which have underlined that outbreak. So again, the security policy has promoted a short-term issues rather than long-term issues. And then the last thing I talked about was this issue of over-securitization and what happens if we do send in the military in every instance, or if we are making everything to be a security threat, does it lose its meaning? And just sort of questioning some of these concerns that we have. I think we're still figuring it out, and I think it changes and it shifts. I think if you'd had this meeting 10 years ago, you would have had a different answer, and I think it's continually evolving to reflect realities on the ground and political priorities. And I think I really welcome this recent shift where we've seen universal health coverage and health system strengthening being brought into the global health security framework and discussions, because it really is the most fundamental way of preventing future outbreaks. I think we're going to see great things with Dr. Tedros' leadership, hopefully, that he really is championing universal health coverage, and if he can bring these two cousins of health security and universal health coverage together in a meaningful way to actually strengthen the kind of underlying sort of horizontal level of provision of health. But I think it's also going to depend on what else happens. What other outbreaks do we see occurring that might change that and refocus what we mean by health security? None of us knew that Ebola was going to happen or Zika was going to happen. So kind of what's the next one going to be? And I think the other thing we need to consider is issues of conflict. So in Yemen and places like that where we have serious conflict happening, what are the security global health security concerns in that? Is it about just say safety? Do we consider that an individual human security level in conflict zones? Should they be health security threats as well? So I think the military, as we saw in Ebola, did play a vital role. I think they're great at doing planning, at control, command, the sort of routine infrastructure stuff, and as we saw, the building of facilities. I think they have a great role there. But I think we have to be careful of two things. One is of the perception and the images. So as Adam highlighted this morning, and as previous work, various colleagues have done highlights, how does it feel if you have a military person giving you care? If someone's coming to your house dressed in military get-up, what does that make you feel? Do you feel threatened? Does that make you feel less secure in terms of your own health or your own sort of individual security? And the other thing is sort of what happens when the military are busy doing their own job. If a war happens, we don't want to become in a situation where we're so reliant on the military that when they are then not the resource that we hoped, that we don't crumble.